Yes, can everyone see it? Okay, I have 15 minutes and I'm going to run through really our experiences, our reflections, and our next steps. And the key principles in all of this have been collaboration, partnership, integration and synergy, and impact on and outcomes on citizens. So I'm really looking forward to the panel discussions and to hear the other presentations as well. Okay, so this is about our response to food poverty, food insecurity issues in Northern Ireland. I had some experience to date and have been working closely with FareShare around our work on social supermarkets, which is why I probably got the job of delivering the COVID food response and leading on that. However, it was a team effort. We had colleagues from Invest Northern Ireland in the team in terms of their food sector experience and commercial experience. We also had a council and voluntary community sector distribution model. We had worked with our health trusts. We had worked with Advice NI, so it was a real cumulative effort. In terms of hard facts, substantial resources were invested in the initial emergency response. We spent almost £7 million on food boxes, more of that later. £3.5 million of our neighbourhood renewal support was made available, a good proportion of which went to support local voluntary and community sector efforts around food poverty and food insecurity. We also a significant proportion of our COVID contingency funds to councils went towards that. Our food boxes and all of that voluntary and community sector effort went alongside, obviously, DE's free school meals payments, and that direct payment was a real win in Northern Ireland in terms of the other parts of the other devolved administrations. The DE system of direct payments worked very well. Alongside the free school meals, DE had the Eat Well, Live Well support, and alongside all of that was about £1 million from independent funders such as the Halifax Foundation, Community Foundation and National Lottery Community Funds. In that period to 26th of June, which was a 12-week period starting on the 7th of April, we delivered over 178,000 food boxes. And that was for people who had shielding advice within the shielding cohort, and also those that were facing food vulnerability, food insecurity. In the period of to the end of July, which was a further 5-week period, 25,000 food boxes were delivered, but that was focused on the shielding cohort. I think it's fair to say that we had some very useful discussions with FSA during this period. Hands up, we do recognise that the food boxes were, there wasn't any social value or limited social value within the food boxes. There was challenges around them being nutritionally robust, but they were an emergency response. They were a static crisis intervention, and Northern Ireland followed the lead within other administrations in terms of the food box provision. Lots of learnings from all of this, and I think it's fair to say too that we did try in Northern Ireland to have a unique financial support services where people who were in direct short-term financial assistance, that was about a specific living expenses grant, and that was introduced in March 2020. And I think that goes some way towards that whole cash first proposal, which is something that is really linked to social value around food poverty and food insecurity. In terms of this next slide, I think that gives you a sense of the support for vulnerable people around the cross-sectoral support. You notice private sector involved there, food banks, community organisations, and when you look across the 11 councils, you'll see a different blend between food banks, private sector and whatever. I think it's fair to say, and to FSA colleagues, we had some challenging discussions around our food response, around the whole prepared food element. We had significant private sector offerings of food to link into prepared food, but it was just challenging around health and safety issues around all of that. And that's something that I know the voluntary and community sector are taking up. Moving on to my next slide, these are some really key observations that we had. In terms of and principles guiding our work post the emergency response and our current work in DFC. In terms of partnership, it is about collaborative working, but it's also about co-design. We have realised through our council distribution models how important they were, their links with the voluntary and community sector, but also how different local council responses were and local voluntary and community sector capacity and capabilities were. So therefore, in continuing that partnership, co-design is a fundamental in that partnership. In terms of intelligent funding, it's about how funding can be best used to support a range of existing and new grantees, and that's all about looking for unusual suspects, but also the usual suspects who are so important in that last mile delivery. And it's also looking at what our funding is there to do, what outcomes does it want, is it about impacting on our citizens. In terms of existing support structures, yes, recognising how important they are, but also recognising that a lot of them are volunteer based and there is issues around fatigue, capacity and capability, and about how we link those existing structures better at local level in terms of their different services to bring a more holistic response for citizens. And that links to the connectivity point. Strong communications between organisations and between departments and between agencies are key. We have a great base in which to build our response now when we are facing local restrictions and the current circuit breaker. Those connections are strong, they're workmanlike, they're practical, they are open and they're transparent. One of the things that we wanted to do, our minister has just announced a series of social inclusion strategy work, and within that the anti-poverty is obviously key. So we're very keen to feed into the work on the anti-poverty strategy work with our experiences around food poverty and food insecurity, and likewise feeding into economic recovery work. And finally, evidence-based. We mobilised so quickly and at pace. There was little data verification and little data sharing. We didn't get the access to the Department of Health data around the shielding cohort. We weren't able to verify need, but that's where the voluntary and community sector really came into its own. They know their communities, they know those in need. They know that with responsibility for distribution of food, that was going to those families and those individuals in greatest need, and that's important. However, in taking the learnings out, we do have significant work to do on establishing baselines, and understanding the data around food poverty and food insecurity, but more of that later. We have been constantly reviewing our responses, and just to give you a flavour here of the interim review that we carried out in May and June of this year, we wanted to understand better the underlying demand factors. We wanted to know better the other activity. We wanted to develop a menu of options to take account of the range of needs and local priorities. That's down to the co-design. We wanted a communication plan. We wanted more coordination, and we wanted a transition plan for those currently in receipt of food support. The key questions that our minister posed to us is, within the economically vulnerable group, is it a poverty issue or a food poverty issue? To what extent did the issues precede the emergency? Obviously, our social supermarket experience led us to believe that there was significant food poverty, food insecurity before the crisis, but that's been underlined by our emergency response. What are the characteristics of those seeking help with food? Are they those in receipt of benefits, those in work? Are they young people? Are they women? When you talk about the economic impacts, our minister is very keen to understand the nuances within the segments of our population who are most impacted. And how do we move from an emergency response towards a longer term food poverty approach? And that's obviously linked to our work on the anti-poverty strategy. We work very hard within our interim review to take views from stakeholders in terms of councils and health trusts and voluntary and community sector organisations. The evidence is there in terms of the lessons learned through a very quick mobilisation. That was really important for us to learn lessons. The needs have been identified, and again, that's around the evidence base and what were priorities. And when you look at that slide there, we were looking at second wave planning. We're in the middle of the circuit breaker right now, And again, the interim review is proving very positive in terms of mobilising very local resources for that. In terms of future objectives identified, obviously holiday hunger is key. Looking at the holistic wellbeing approach, and again, that's all around wraparound services, linking perhaps to some experience of our social supermarket model. Looking at rural urban, rural has been a massive issue, and serving rural needs is one that we are working very closely with councils on. In terms of the sustainability of approaches, collaborative decision making, collaborative co-design, upskilling staff, knowing that the capacity and capability are stretched. Fatigue is there, but making some investments in developing that capacity and capability. And embedding this role of the VCS in that whole local and regional coordination. I think it's fair to say that in DFC, we've established an emergency leadership group. The VCS play a major role within that. And that, we've really been successful in embedding the VCS within that and getting that broad recognition of the role. In terms of our delivery models now, criteria is really important in terms of that, not in a policing way, but in terms of understanding the need and understanding the roundness of the need. It may be food, may be the first characteristic of it, but there's obviously other needs that are there, and it's about linking those needs to other supports. Data sharing is important, and we've already mentioned co-design and funding. So that was then. This is now our current action as a result of the review. We have made an additional investment of almost 800,000 supporting FareShare. We had an existing relationship with FareShare in terms of the social supermarket pilots, 5 of those, but we have made this investment, and that investment will be around delivering a regional supply of food to community food providers across all 11 councils, but also I think in terms of sustainability to FareShare, working with them on some further warehousing and supply dynamics within their model. In terms of the evidence base, we are working with Sinead and Ulster University. We've supported a boost to the Food Foundation survey, and Sinead is kindly has provided us with a draft report and some analysis on that. And we will feed back to you whenever we're able to do that around that. In terms of our work with councils, while we recognise that food may be at the forefront of need, we wanted to try and link the council responses to other programmes and other supports in their local area. We developed 3 principles: recognising and maximising the local infrastructure, and that's back to that building capacity and capability piece, building on the partnerships established, and it's also recognising that building those partnerships with other support services in the voluntary and community sector, whether they be supports around mental health, supports around domestic abuse, supports around debt services, financial inclusion services, alongside the food. And that's linked to brokering strategic and programme links within and between actions. And I think it's important to say that the council community plans, we're aware of a number of those plans are being re-looked at in the context of the COVID experience. And then moving on to our social supermarkets. They have been a key platform for us in food poverty and food insecurity. And prior to COVID, Minister had agreed to development of a business case for rollout of the social supermarkets model across Northern Ireland. We are in the middle of that business case and are in the middle of taking forward the co-design of the social supermarkets. I think it's fair to say that we were keen at the very start of the social supermarket pilots to develop an OBA approach, and that has been really, really important to us in terms of our knowledge of the impact a social supermarket can have on individuals. We have SIB delivered an evaluation of the social supermarket pilots up to the 31st of March 2020, and that demonstrates the positive impact of the model and its potential to deliver against a range of programme for government outcomes. As of the 31st of March, in excess of 1,000 individuals had access to service across the 5 pilot sites, And the evaluation indicates that access to affordable food, produce and wraparound supports has helped to positively change the life circumstances of members and their families, alongside evidence of increased financial security. We believe that the social supermarket model offers a sustainable and holistic approach to tackling food insecurity. And as we continue to face restrictions and the consequences of the crisis, they will have an important role to play. So that's where we are. I think it's finally the department, in conjunction with its community partners, will continue to signpost other ways in which they can access food. That's priority online shopping deliveries, delivery services from a range of local shops, local volunteers, and local support through voluntary and community sector organisations. Within that gateway, Advice NI and their COVID community helpline is really important, and their links this time around to local advice services will allow those citizens that are in need of support to be signposted to both direct food support, but also to a range of other services. Folks, my final slide is really saying, in going forward, we are committed to delivering long-term sustainable solutions to poverty, including food poverty. We are aware of the increasing need for food and the likelihood of this continuing as the economic consequences of the pandemic continue. But I think it's fair to say that we are working very hard in DFC to work with our councils, with our VCS, with other partners, to deliver innovative, sustainable approaches to food poverty, food insecurity, and feeding those lessons back to the development of our anti-poverty strategy. I'd like to finish there, and again, happy to take questions.